Well, hi, my name is Brenda Laughhunn, and I've had the privilege of serving SSM Health at Home Hospice Branch Manager in St. Louis since 2017. The journey to my present role with SSM Health spans over 25 years working in hospice and palliative care across the United States with experiences that include small and large hospices and also include the state of Hawaii. I began my nursing career in ICU with all its amazing resources for aggressive and curative treatment. The ICU taught me a lot, but it also caused me to ponder the transition between curative and aggressive treatment versus end-of-life care. As an ICU nurse, I felt troubled when I had patients that were dying in very much a sterile-like environment, alienated or isolated from those they loved, and weren't able to be with them during that most critical time. This inspired me to seek more, and with that, a personal connection to touch those families at a time when they were most hurting. For me, it was hospice and palliative care. My first experiences in hospice and palliative care truly taught me what being present was all about. It's really being there for people at end of life when you really need somebody to be near you. In the late 80s, AIDS was a fairly common end-of-life disease. As a nurse caring for those patients with AIDS, it was apparent that they were victims not only of a terminal illness, but also of an unreasonable fear and gross ignorance that made them modern-day lepers. They were ostracized and shunned and many times misunderstood. Years later, I served as Director of Clinical Operations for Hospice Hawaii. This is where I had an opportunity to care and support those some 60 residents remaining in the community of Kalapapa on the island of Molokai. The island was remote and difficult to reach. I arrived for my visits by one of only two ways to access, either by small aircraft or by mule ride down some of the tallest sea cliffs in the world. Its remoteness was by design. The community here was formed years before by those persons with leprosy, a horrid, debilitating, and devastating disease, highly contagious and frightening to behold. Lepers were commonly banned by society. They were set aside, made to be away from others who were disease-free. Leprosy, as we now know, is Hansen's disease. It's caused by a bacteria. And while the disease is treatable, the damage from the disease is irreversible. Hospice Hawaii was tasked with providing end-of-life care for those residents who were living with the effects of the disease. They were legally blind, missing limbs, nose, ears, and suffering nerve damage. I was touched by their suffering, the legacy of their suffering, and the way of which they dealt with the adversity, and the vitality of their community was heartwarming. Even though in the late 60s, they were allowed to freely leave this island, many of them chose to live out their days because this had become their home. For nearly a century, Kalapapa had been the site of pain, suffering, and obscurity. More than 8,000 people were banned to this remote peninsula, exiled because they had been infected with leprosy. Many shared their stories of being forcefully removed like criminals from their homes. This included young children and very elderly. The exiled were forced to overboard upon approaching Kalapapa because the waters around the peninsula were troubled, and also because the ship's crews feared being exposed to the disease themselves. This resulted in many drowning before they ever reached shore. One can only imagine the nightmare that they must have went through. Amidst the tragic stories, I also heard human and spiritual heroism. A family member could elect to go with a loved one diagnosed and tagged for exile, such as a mother of a child or a child of an aging parent. However, in doing so, they voluntarily committed themselves to remain on Kalapapa for the remainder of their own lives, whether or not they were ever diagnosed with the disease themselves. I remember the powerful story of the priest, Father Damien. He volunteered to minister to this community when no one else would. He went to this settlement to be present. He went there to improve lives, share God's love, construct sturdy buildings, build coffins, and often dig the graves of those he served. He was told, "Don't touch them." But within months, he was eating with them, dressing ulcerated sores, and holding communion wafers to their tongues. Decades later, nearly blind, covered with festering sores, he too died of the disease. I hold up his brilliant display of purposeful work for us today. He journeyed not just to them, not just to be amongst them, but to truly link his journey with theirs, even to the point of losing his own life, and dare I say, finding himself on that path. Though not at as costly as a price as Father Damien, this has helped me to understand and to cherish the difference between going to our patients and families as a job, or even going beyond amongst them to linking my own journey with theirs. Working in hospice, I must be willing to risk loss and be vulnerable in order that I might find purpose for my own life. I journey the hospice way because of our Navy patient. He led such a troubled, alcoholic early life that he was painfully estranged from his 2 sons for decades. As he neared the end of his life, he wrote to them saying he was terminally ill and only wanted to connect, even if it be in a small way. You see, they had lived within 2 hours of him for decades with no contact. They both rebuffed him harshly at first, avowing, "We will never call you Dad." If he had been distracted and drained by futile, aggressive care measures, this may have siphoned off his energy and ability to become whole, if not healed. But with the counsel and support of our hospice team, over the course of 3 months, he gradually reestablished contact with his sons. He came to meet his only grandson. He got to know his youngest son's future wife, and they all together gathered for his last Father's Day. On the Sunday following that gathering, his eldest son was shaving his dad in his recliner as our staff overheard. "Didn't we have a great time, son?" "Yes, we sure did, Dad." For you see, they rediscovered what love and forgiveness is all about through the title of father and son. He died a short time later. I journeyed the hospice way because of a couple in their 80s in the nursing home. She was our patient and their resident. For over 9 years, her devoted husband arrived in his wheelchair every day to feed her unless he was sick. As she neared the end of her journey, she was blind and her body no longer desired nourishment. Her husband was nearly deaf, and we heard him uncharacteristically yelling at her, "How can I help you get better if you don't eat?" Of which she softly replied, "Please tell him I love him." He was afraid and linked loving her to feeding her. She was trying to say goodbye. But in the midst of that, they were missing the message that each one wanted to give. Our hospice team member was witnessing this and leaned into his good ear and shouted out loud with those precious words, which in any other context would have seemed very comical. "She says she loves you." "Huh? What?" he replied. Now compounding his fear and frustration with our inability to communicate meaningfully, our team member shouted, "She says she loves you," as she guided her hand to touch the tears unseen that coursed down his cheek. With the help of hospice, the connection of two hearts was made. As I reflect on my own personal journey, I find peace and satisfaction in being present and finding purpose in doing what I do. Perhaps I would add another line to that well-known prayer of St. Francis, which reads, "Lord, grant that I not so much seek to be consoled as to console, to be understood as to understand." The invitation for us today would be to pause and consider, Lord, help me not so much to seek first to share my wealth of resources, as first to connect with the one before me right now. Thank you for the opportunity for me to connect with you today.